Welcome back to Learn Astrology with Mary. My name's Mary English. You can find me at www.maryenglish.com, maryenglish.co.uk and UK Astrologer. Hello, how are you? Just before we start, I'm going to do a little plug. Hardly ever do those. If you go to my website, so that's maryenglish.com, there's a pop-up box. If you put your email address in there, I will send you my newsletter, which you can unsubscribe from at any point you like. And in that newsletter, so this is the June newsletter, there is a discount. The discount is for 15% and it's for every service that I offer, including the bronze level pre-recorded astrological report, where we're not working one-on-one live on Zoom. I'm analysing your chart, answering your questions about your chart, emailing you a link to the audio recording that I've made about your chart. So that 15% will include that offering as well, and the discount only applies until the end of June. So it's only to the end of June 2026, and then boom, that's the end of the discounts. There won't be any more this year. So that's just the little plug. But if you go to maryenglish.com, subscribe, I will send you the discount. And if you really don't want to subscribe but you'd like the 15%, then just ping me an email, mary@maryenglish.co.uk, and I will email you the newsletter with all the details in, so you're not even subscribed. I'll just forward it to you, or even I can give you the discount. So whichever way you want to do it that suits you the most, then do ping over there and make the best of the discount. Now this week we are covering something that is classified in astrology as a thing called medical astrology. There's a fabulous book if you want to read it. I have mentioned it before, but I'll plug it again. It's a handbook of medical astrology by Jane Ridder Patrick, and it is published by Apple Press, and I think it went out at, it's £15.50, but I think I got it at a discount somewhere or other, and it was published in 1990. And a handbook of medical astrology. I've got the second edition revised and enlarged, and we're also using today Managing Your Health and Wellness by Diane Cramer, which is a fantastic book. So both of these books come under the banner of medical astrology. And what is medical astrology? Medical astrology is where we can assist someone from what is going on in their chart, either something that they're natally born with or something that is being influenced by a transit that has happened for an event, like a health event, or is happening at the moment. So medical astrology can be used in three ways, basically past, present, future. Well, not so much future, but like now going forwards. Especially if people are under stress, especially which there will be if they're Aries and they've got Saturn going over their sun sign, or you've got it going over your ascendant or your moon. That's near enough any time when someone's going to want some help when Saturn makes a transit. And the only one planet that I want to talk about today for medical astrology is the planet Venus. Now, Venus is quite harmless planet. It's not one that's associated like Saturn or Uranus might be to sudden changes or difficulties or stress or whatever. Venus is a nice friendly planet. However, there are things that it represents in your chart, and if you were born with it under stress, you might not even know that until later in life when something happens. Now, we're going to be using Venus today to talk about, it's not a diagnosis, but to talk about type 1 diabetes. We're not going to go out there and make loads of diagnoses from people's charts saying, oh, you're susceptible to type 1. No, you're not doing that. What we are doing today is talking about someone who does have type 1 diabetes and what it shows in their chart as far as Venus goes. And I also am doing this episode from personal experience. I might have mentioned it once or twice, but not a lot. I myself have type 1 diabetes, so I do know what I'm talking about when I talk about type 1 diabetes. I've had it since I was 23, and I'm 66 now. Okay, and I've also worked in the health sector for a long amount of time. So that's just the background. Okay, so we're going to go on to Venus. Now remember, of course, that Venus isn't just associated with diabetes. I'm now quoting from Diane Cramer's Managing Your Health and Wellness. Venus, the planet. Venus is associated with the sensory system of the body. It rules the kidneys and their role in regulating the balance of the body. Kidney function or dysfunction is ruled by Venus. This planet has rulership over sugar and is associated with diseases such as diabetes and hypoglycemia. I'll explain those two things in a minute. Venus also rules the veins and thus the venous circulation of the body. Phlebitis and varicose veins are Venus-ruled conditions. Venus rules the sensory organs and their ability to function. It rules the sign Libra, which has to do with the skin and is therefore associated with benign skin growths or minor skin irritations. One's personal taste in food is associated with the placement of Venus in the chart. Venus is also a factor in body tone. Now, she says here diabetes and hypoglycemia. There are two main types of diabetes. So there's type 1, which is what I have, where your pancreas is knackered. It doesn't function and you have to inject insulin. Okay, so I'm just putting it very, very simply. Type 1 diabetes is generally called insulin-dependent diabetes and involves injecting insulin. Type 2 diabetes, which far more people suffer from, is caused by possibly being overweight, possibly not taking enough exercise. It can also, type 2 diabetes can happen to people that aren't overweight and do exercise. However, with type 2 diabetes, people don't generally, some do, but generally don't inject insulin because it can be controlled by diet, exercise or certain drugs. Okay, but there is a big difference between type 1 diabetes and type 2. Back in the day, if you had type 1 and that was before the invention of insulin, you were dead. Okay, so just putting that out there. There is a big major difference between type 1 and type 2. She also mentions there about hypoglycemia. Hypoglycemia is when your blood sugar levels go so low, you get shuddery, shaky, and can feel faint and probably can conk out. With a person with type 1 diabetes, when they inject insulin, if they've taken too much insulin, they'll conk out and they'll have a thing called a hypo. A hypo or hypoglycemia is very, very low blood sugars. If we're talking about numbers in the UK, the numbers is between 4 and 6, and if it gets less than 4, then bump, you're in a danger zone. If it gets less than 2, basically you're on the way out and you're likely to go into a coma and die. And equally, this is where diabetes gets complicated, with type 1 diabetes that is untreated, you'll equally go into a coma, and that coma is because your blood sugars are so high. But this isn't, we're not at the doctors now, we're just doing some outlining. Okay, so that's the differences between type 1 and type 2, and Venus is associated with that, but with other things as well. Okay, but today we're just focusing on type 1 diabetes, not necessarily type 2. Now, Jane tells us on page 54 of her Handbook of Medical Astrology, Venus represents homeostasis, kidneys, hormonal activity, and veins. Homeostasis in the kidneys. Venus is the principle of harmony, relationship, and equilibrium. Translated into body terms, that means homeostasis and hormonal secretions. Homeostasis, from the Greek homos, meaning the same, and stasis, standing still, is the body's ability to maintain the stable internal environment that it needs to function properly, whatever the external circumstances may be. One of the ways it does this is to keep the chemical composition of the body fluids constant through the action of the kidneys, which are ruled by Venus. The kidneys filter out all the unwanted soluble material in the blood and maintain the correct balance between acidity and alkalinity and the amount of sodium, potassium and other ions in the body. Failure of the kidneys to function properly has serious consequences for health. Oh yes. Hormonal activity. inner conditions are also kept constant by the action of the hormones, which are secreted into the bloodstream by the glands. It's questionable whether Venus actually rules all the hormones as such. It's much more likely that it rules the overall feedback mechanisms rather than individual hormones themselves. It does seem, however, to have a close association with female sex hormones. Venus has been traditionally linked with diabetes, so perhaps it's involved with insulin production and secretion, although some writers claim this function for Mars. The section on the cardinal cross in the next chapter may help clear up this confusion. I feel that the significance of Venus in maintaining health is greater than is normally credited. Then she goes on to lust and legacy, which we're not going to be talking about. So diseases of Venus include venereal diseases, kidney and bladder disorders, prostate problems, health consequences of overindulgence, e.g. in sweet food or sex, diabetes, hormonal disturbances, congestion, swellings, benign tumours and cyst formation, and vein disorders. She then quotes from Lily, who says, and it's all in Old English, but see if I can, Lily's list of organs and maladies associated with Venus. The matrix, genitals, paps, throat, liver, sperm or seed in man or woman, suffocations or defections in the matrix, pissing disease, gonorrhea, debility in the act of generation, stranguli, weaknesses of stomach and liver, French or Spanish pox, imbecility or desire to vomit, or that disease which presents after eating or come up again. The matrix is the uterus and the paps are the breasts. The pissing disease is diabetes. Stranguli is painful urination where urine is passed drop by drop. French or Spanish pox is syphilis. So that's two authors' opinion on Venus. Now the chart we're going to use today is from a guy called Chris Pennell. He's a UK rugby person that plays the sport rugby. He's mentioned on the Diabetes Association website. I'm not a member of them. I used to be back in the day, but anyway, not anymore. And he's some sort of advocate for them or representative. And what's quite cute, I don't want to use the wrong words today, what was interesting is that we've got a date of birth for him. There were plenty of other people that were sort of I don't know what you call them now, patrons, that type of thing, for the Diabetes UK. However, this was the one that was more famous, and we've got his birth date because he's done a lot of rugby, etc. So his date of birth is the 26th of April 1987. He was born in Worcester in the UK. Obviously, because he's British, I don't have a birth time for him, but for the purposes of today, it doesn't matter, because what we're looking at here is the aspects that Venus makes, or the aspects that are made to Venus. Okay, so Venus, I sort of tend to think of as when Venus is under stress from another planet. I tend to imagine that planet in the chart is being sort of having a nasty conversation with another planet, rather than Venus is sending, in this case, he has Venus conjunct Jupiter, Venus square Uranus, Venus square Neptune. I don't think of that as Venus is giving its energy to Jupiter, Uranus and Neptune. I see it as the other way around. Those three planets are sort of Venus is in the firing range from those three planets. That's how I imagine it, but that's just me. So he's got his Venus at 4 degrees Aries. His Uranus is at 26 degrees Saggy. His Uranus is at Uranus is 26 Saggy, and his Neptune is 7 degrees Capricorn. So if we're looking at in sign as opposed to in range of orb, Venus is being more attacked, is that the right word, by Neptune than it is by Uranus, because Uranus is still in Saggy, hasn't made its way into the sign of Capricorn to make a within sign aspect. So if we knock out sort of Uranus for the purposes of talking about it, but anyway, mathematically they're square. and Venus is conjunct Jupiter. I also wanted to do this podcast about the Venus and Jupiter conjunction that's just been going on in the sky. It's lovely. Been seeing it this last few nights. But I wanted to talk about it in relation to diabetes. And this gentleman has it, and he got his diabetes when he was 19. Now, I'll cover the transits in a minute. But because we don't know time of birth, it does make it a little more tricky. I've used 6 a.m. and I've used the whole sign method, and you can see the charts on the show notes, which the address of is astromary.libsyn.com. So there he is. He's got his Venus is under stress. Now, the reason this is important is because what is the ruling planet to the sign Taurus, which is what he is sun sign Taurus, and he's got moon sign Aries. So the ruling planet to his sun sign is Venus, and his Venus is under stress. I don't think his moon's also square to Neptune, and it's conjunct to, because he's got a little sort of stellium of Mercury, Jupiter, Moon, North Node, Venus are all in Aries. And because I've used the whole sign method, it's more easy when you glance at a chart to see what he's got. And he's got nothing else in Taurus, it's just his sun sign. So it does mean that if the only planet that is in your sign of the zodiac that you are, and you've got planets in everything else except your own sun sign, it can be a little bit more tricky for you as a person to be atypical of your sign of the zodiac, because you've got no other planets backing you up as that sign. I have seen that quite a bit, that people that the only planet that they've got is their sun sign, they will sort of waver about the place because they've got these other influences in their chart. So let's read what Diana tells us about when Venus is aspecting. So in Chris's case, he's got Venus conjunct Jupiter. His Venus is 4 degrees and his Jupiter is 13 degrees. So it's just within orb. His moon is actually nearer to his Jupiter because his moon's 12 degrees and his Jupiter's 13. But anyway, Venus conjunct Jupiter. You are sociable and optimistic. You love to have a good time, which can lead to health problems caused by excess. With Venus ruling sugar and Jupiter ruling fat, you have a tendency to indulge in foods high in both. There can be a lazy attitude towards health and a tendency to take your good health for granted. You need to exercise and follow a stricter health regime. Now, the strange thing with Chris is there was no shortage of exercise in his life, because he's a rugby player and he's been playing rugby since he was rather small. And he says on his journey with diabetes, I was diagnosed with type 1 diabetes in my second year at Worcester Warriors. And pre-season, every player has a routine blood test. Abnormally high blood glucose were found in mine. The symptoms, which would normally be easy to spot, being tired or being hungry, were being masked by high-intensity training. The diagnosis was confirmed the next morning with a finger prick test. When I was first diagnosed, I had no idea what impact it would have on rugby. I wasn't sure whether I'd be able to play. So I asked the club doctor, what does this mean? And he said, Chris, we'll get the best advice, but it isn't going to stop you doing what you want to do. So from that moment on, because of his confidence, I was sure that I was going to do everything I wanted to do. And then he talks about his insulin regime, which I won't go into because it might not make any sense to you unless you've got a bit. I'll put the link on the show notes if you want to read more. So he's born with Venus overdoing things. He doesn't say what his life was like before he did that, but he definitely was doing lots of rugby, and that's why his symptoms didn't show up. So he cannot say that type 1 diabetes is brought about by not exercising. Okay, type 2 he can, but type 1 we can't, but he was already doing that. Now, when Venus is in aspect to Uranus, which is why I've got an opposition, and he has a square, it's the same interpretation. So it says here, Venus square or opposition Uranus, he's got the square. You're excitable and easily bored. You may have poor circulation, especially of the extremities. You may have episodes of spasmodic kidney pain, a heart murmur, or heart palpitations. You have a progressive attitude towards sex and need to guard against sexual excess. Didn't happen in my case, and I don't know if it happened, it is. But anyway, that's out there. So now we're going to go on to the Venus square opposition Neptune, which is what he's got. Okay, you could be spacey, unrealistic and neurotic. You could be hypersensitive to toxins in the air or other allergens such as food additives or preservatives. You may be drug sensitive, requiring lower dosage than what is prescribed. You may have allergic reactions to some varieties of seafood. Your metabolism can be upset or out of balance. The sugar metabolism in your body can be out of whack. There's a tendency towards alcohol or drug abuse, which can lead to a breakdown in the body. Women may have a weakened glandular function, leading to weakness in the female reproductive organs. There can be flabbiness due to lack of exercise or water imbalance in the body. So he's got the square, and his Uranus and Neptune are in different signs, but mathematically the case. So his Venus is under stress. So he was born with his Venus, inverted commas, astrologically under stress. And it wasn't until he was 19 that he got the diagnosis. Now, he doesn't mention how long, and no one would know. I mean, that's an open question of when might this have started, what might have triggered it off, why do some people that are susceptible to it get it and other people don't. That's a whole different ballgame. So I've used August 2006 as the transits, and Pluto appears to be inverted commas, mapping what was happening with him, yeah. I can't take the Sun or Venus or Mercury or anything together because I don't know exactly what month. All I know is that it was 19 years old. So we've got to look at the major outer planets. Neptune transiting was 18 degrees and his sun sign's 5 degrees Taurus. So that's out. Chiron, incidentally, transiting is 6 degrees and his sun is 5. So we could, if we were doing a Chiron episode, we could, look, Chiron's forming a square to his sun sign. So wounded healer, problems, etc. Uranus is in Pisces, so that's not aspecting his Venus at all. So nothing's directly aspecting his natal Venus. Now, hold with me in this. What is happening is Pluto transiting retrograde is 24 degrees Sagittarius and his natal Uranus is 26 degrees Sagittarius. Now his natal Uranus is already sending difficult energies to his Venus, so transiting Pluto, and when he was born was in the sign of Scorpio. It's gone chug all the way through Scorpio, and now it's gone chug through the majority of the sign of Sagittarius. It's now 26 degrees, and it's then, but because when you get a transit that is conjunct a natal planet, it magnifies the aspect that you natally have. I am so into conjunctions to natal planets because it's sort of like an extra army of baddies or goodies, depending, are coming along and magnifying the internal things you've got. Okay, so I expect that it was the Pluto transit that was magnifying the Uranus, sending the square aspect to his natal Venus. Didn't help. We'll put it like it didn't help. It didn't cause it. Nothing caused it. We don't know what caused it. He was born with this thing and whatever. Yeah. Transiting Jupiter is 9 degrees Scorpio and his natal Pluto is 8 degrees Scorpio. So that's another exact conjunction. And Pluto natally in his chart is opposition to his sun sign. Deep change and transformation. Jupiter comes along and he's born with Moon conjunct Jupiter and Venus conjunct the Moon and Jupiter. And then transiting Jupiter comes along, go poof into his Pluto, which is opposite his sun sign. So it was sort of like it was sort of make it or break it time. Yeah, Jupiter magnifies things. Yeah, so if we're looking at transits, I say all I could take into account were the slower moving ones. I couldn't do the fast ones, and Jupiter would have been in the sign of Scorpio for the whole of that year, and so I don't know exactly, but I definitely know that Pluto certainly wasn't helping as far as transits go. Now, then you're going to ask me the question, what happens if I was born with Venus under stress from a natal planet and I don't have diabetes now, or I give birth to a child, or there's a child within my family or a relative that's very small at the moment that has that? Should I then, be really sort of strict on them and do this, that and the other? And I'll tell you a story. I had an auntie, I've mentioned my auntie before, this is my Auntie Jo, the one that I've got her ephemeris, gave birth 2 boys, okay? Boy number 1, boy number 2. Boy number 2, she was always worried. Don't ask me, I can't remember why, but she was quite worried that he might get diabetes. I think it was because of someone in her husband's, this is my uncle's family, that did have diabetes. There was some sort of relative somewhere that had it, and she was worried that child number 2 would get diabetes. Anyway, grew up, everything was fine, la la la. He went away to university, and while he was at university, he eventually went into a coma and went to hospital and got diagnosed with type 1. Now, there was nothing that my auntie could have done other than worry about the fact that this might happen. I don't think she especially did anything drastic with his diet or exercise or anything like that. And I sort of think, if you look at someone's chart when they're very small and you go, oh, you're going to get diabetes, but you're going to make a predictive, you're going to make an embedded command to someone. There's an expression in hypnotherapy that if you say something strongly enough and repeat it enough, it goes deep within to someone's subconscious and eventually they manifest it, not from their own coalition, not from their own consciousness, but because somebody's deeply embedded it into their consciousness. So we have to also remember that when clients come and see us, they're very open to what we might be telling them. Be very, very, very careful how you talk to clients and what you might or might not say with them, because they'll hold on to something negative that you might say for absolutely bazillions of years and then might unfortunately manifest it. So it's a big responsibility being an astrologer, okay? It's not something to, take like, well, I don't think it's something to take lightly. So in answer to that question, you gave me, I've got a stressful aspect to my Venus. Does that mean I'm necessarily going to get type 1 diabetes? The sort of question is like, well, who knows? It's more than just the aspect in your chart. It's the environment that you grow up in, the relatives that you might have, the school that you go to, the people that you hang around with, what else is going on in your chart. There's never just one thing in your chart that indicates something. And it also depends whether or not you're going to identify with the disease that you've got, which I certainly don't. So this is probably the only episode that I talk about it in any great detail. I don't see myself as a diabetic. I see myself as Mary that has type 1 diabetes. It's a very, very small part of my life because it doesn't identify who I am, but don't get me started on that one. So we're talking today about Chris, and his Venus is under a number of stressful aspects, and equally Jupiter being conjunct to something in your chart isn't necessarily a positive thing, because Jupiter is a planet of excess and doing too much. And if your Jupiter is very near, in Chris's case, it's very near to his moon, so he's going to feel things far more, and it's not far away from his north node and his, so it's conjuncting his moon and conjuncting his Venus. It's not far away from his Venus. So it's going to overdo what everything about Venus is all about. People that have got natal planets, personal planets, conjunct Jupiter don't just do stuff. They can overdo it. So we have to remember that the Jupiter isn't, and the conjunction of it isn't always a positive thing. But squares and oppositions equally aren't always negative. I've talked about this before. I've got Sun and the Moon square to each other. It means that the 2 planets in my chart are having an argument constantly, so I have to play middleman to them. But when you've got a supposedly stressful aspect in your chart, it might give you the impetus to go off and do stuff. If your whole chart is one great big trine, you might just be the Buddha. So you're just Mr. Calm and whatever, and you just Buddha. Yeah, you're just relaxed and meditative. It depends on lots of different things. So have a look at your Venus if you do have type 1 or know someone who has, and just see if their Venus is under a natal aspect that could be stressing it in some way. And I'm not saying you're using that as a diagnosis, but that's something to be considering for the client or for yourself. Is there any way to make that supposedly inverted commas stressful aspect more smooth and less erratic? And when Uranus is involved, there's always erraticism. When there's Neptune involved, there's lack of reality to things, sort of going off into a dreamy space, etc. And there are plenty of other planets that can form aspects to Venus, and maybe the type 1 diabetes that the person has from that stressful aspect is going to manifest in their lives in a different way. Because in my case, it's this opposition to Uranus. It's very in or out, and my diabetes was, and what I don't want it to ever be, is to be erratic. I have what's called fragile diabetes, so the blood sugars go up and down, because it's exhausting doing that. So I aim for smoothness, yeah? So you could help a client with a challenging aspect to their natal Venus by talking through with them what things could you do or would fit into your lifestyle that will suit calming down that challenging aspect. Are you aware that you have this challenging aspect in your chart? How is it manifesting for you at the moment? What could you do to help make that better? Always ask your clients, what could they do? What would they like to do? Do they want to do it? They might not want to do it. It's out of your hands. You can't force a client to do something. But have a discussion about those aspects that are in the chart that could be causing some sort of challenge for them. And is there a way of making it the opposite of a challenge, that is something that is positive for them and allows them to be more fluffy and enjoyable human being? So today we've been talking about type 1, just a little bit. We've been talking about the chart of a rugby player called Chris Pennell. We're looking at Venus being under a challenging aspect from outer planets, and also a mid-planet, which is Jupiter, which is what's going on in the sky at the moment. Venus and Jupiter are pretty close together. I think they're moving apart a bit now. So I hope that's helped. I hope that's given you a little bit of insight, and apologies for talking about myself, but I just wanted to put into context why this episode is happening and what experience I already have in that subject matter. And so if you've got a stressful aspect in your chart that you would like to discuss, or for me to discuss for you on the podcast, then do get in contact. It's Mary@maryenglish.co.uk, and I'll be back next week. Bye bye now.